The federal government is struggling to vaccinate Americans against the coronavirus, and Vice President Kamala Harris is now blaming the previous administration for that. Natalie Brand reports from the White House.
Vice President Kamala Harris says the Biden administration is starting from scratch when it comes to boosting the nation's COVID-19 vaccination effort.
There was no national strategy or plan for vaccinations. We were leaving it to the states and local leaders to try and figure it out.
States are opening more mass vaccination sites and expanding eligibility, but they're missing one critical element.
It's constrained by one thing now, simply supply.
This comes as experts warn of a surge in cases from variant strains.
The next 14 weeks, I think, will be the worst of the pandemic. People don't want to hear that.
That surge could set back the federal government's push to reopen schools.
Epidemiologist Michael Osterholm advised President Biden during the transition.
We will get some open beyond what we have now, but then it's going to likely be a real challenge for them in the next 6 to 8 weeks as these surge numbers begin to increase.
A vaccination clinic was set up in Chicago this President's Day to inoculate 120 teachers and public school employees. Federal reopening guidelines do not mandate teacher vaccination. And beginning Monday, healthcare.gov is open for a special enrollment period to help those who lost health insurance during the pandemic. Natalie Brand, CBS News, the White House.
According to Johns Hopkins University, more than 2.4 million people worldwide have died from COVID-19 since the pandemic began. More than 109 million cases have been confirmed. A number of those are people in the United States. For more on the state of the pandemic here, let's bring in Politico health editor-at-large Joanne Kenen. Joanne, welcome. So COVID numbers in the U.S. are falling. Johns Hopkins is reporting the nation's 7-day average for new cases dropped below 100,000 after spiking to nearly 250,000 back in January. But public health officials warn we're not in the clear. What is causing the drop in cases, and what needs to be done to stay on the downward trend?
Well, the drop in cases is clearly good news. It's not just drop in cases, it's drops in deaths. So all of us can be grateful that fewer people are dying. But this isn't over. And what we've seen over and over again it's almost a year now, is every time there's good news, we overreact. We loosen up. We want to go back to normal so badly. We want our old lives back. We want our economy back. So when we see good news, we tend to think it's safe to drop some of our protections. But these numbers are still really, really high. You know, we had a low of, I believe it was 70,000 cases yesterday. That's the lowest in a long time. But that's still 70,000. We're not safe yet.
Well, officials say there are now 7 variants of COVID-19 in the U.S., and this includes the strains first discovered in the U.K., South Africa, and Brazil. There are also new homegrown strains of the virus, which are similar to the variant first found in the U.K. So, Joanne, how might that impact efforts to get the pandemic under control?
We know that we now have vaccines. We don't have enough vaccines. If anyone has tried to get one or tried to help a relative get one, we know there are more people who want them to have them. We have vaccines, though, and we're going to have more of them available soon. They do not work as well against all of these variants. Now, the data is still preliminary. They do work. They're not useless. Some of them probably work better than others because more vaccines are coming on the market than we expect in the next couple of months. But these new variants, they're contagious. The one that was discovered in Britain is really contagious. It spreads more quickly. So that's going back to what we were just talking about. Cases are down, but if we let these variants take root, they're going to go right back up again. So in the short term, we still need to wear masks. We still need to distance. We still need to do all those things that we're doing because it's vaccines plus everything else. It's going to take a few months to vaccinate everybody. In the meantime, particularly with these highly contagious variants, we need to still, in our daily lives, we have to act as safely as we can until we get what they call herd immunity, which is just a whole lot of people vaccinated, until we can get safe. And we may need boosters. We don't know yet. It looks like we're going to need some kind of boosters as the virus changes. And that's what viruses do. Viruses change. It's how they're programmed biologically. They evolve. We evolve too, but more slowly. So until we really I don't want to imply that the vaccines are not a huge breakthrough. They are. I'm speaking to you from New Jersey, not my home in Maryland, where I've been here for 6 weeks trying to get my mom vaccinated. Vaccines are hugely important, and these are safe and they're effective. But the virus is changing, and it's changing to something a little different, a little more contagious. And as we try to go back to normal, as we try to open our schools, we've got to be aware that there are at least 7. There may be more. And if there's 7 now, there may be 8 next week. Doesn't mean that we can't beat it. But we've got to stay 2 steps ahead of it, not 10 steps behind it.
Well, Joanne, let's talk about getting kids back to school. The CDC says in-person schooling can resume safely, yet without a requirement to vaccinate teachers, many educators still have safety concerns about in-person learning. So what's being done to address those concerns?
Well, the recommendation is to start moving back to in-person learning. The recommendation is not open every school and get every kid back tomorrow. There have to be safety steps. There has to be a certain amount of distancing. There have to be masks. There have to be, some ventilation is being talked about. The CDC says, yeah, we understand why teachers want to be vaccinated, and it's up to states, and many states are prioritizing it. So the CDC is saying it is not essential that every teacher is vaccinated. You can open schools safely. Some communities, New York, for instance, they've had their schools open. So can you move back into in-person learning at least part of the time? Maybe not 5 days a week. They're starting about talking 1 or 2 days a week. They're starting about it's safer and easier with little kids than it is for high schoolers. Can you move back without vaccinating every single teacher? From a science perspective, the CDC says yes. State officials also understand that teachers are nervous about going back to a classroom without getting vaccinated. So different states are handling it differently, how fast they're getting the teachers vaccinated. Some of them are really emphasizing it. Others are saying not right now, but soon. And the move back to classrooms, and we all understand why that's important, to do it safely. It's not a flipping the switch. It's a moving in that direction.
Well, earlier today, Biden administration COVID advisor Dr. Michael Osterholm told CBS this morning the variant first detected in the UK will cause another surge in U.S. cases over the next 14 weeks. So, Joanne, what do we know about what the administration is doing to counter that?
Basically, the tools we have are good old-fashioned public health. That's the masks, which in this country have been very politicized. But, masks protect you, and they protect other people around you. So masks are really, none of us like wearing masks, right? But masks are really important. And in this country, we've let them be a symbol of our politics instead of our basic health for us and people, our family members, or our friends and our neighbors, or someone, if you do go to a store, someone who's in the aisle, down the aisle from you. So masks are important, hand washing is important.
Yeah, people need to just exhibit more patience if they can. It's something, as you point out, that has a lot of folks weary, but it is where the science is most certain at this point, even as we wait on the science to come in on the vaccines and on these variants as well. Joanne Kenen, Joanne, thank you very much for your time. Really appreciate it.
Thank you so much for having me.